Health Hub in Ballincollig and say good afternoon to Anneliese Drizzell. Afternoon to you, Anneliese.
Hi, John Paul. How are you?
I'm fine. How are you keeping?
Good, thank you. Sure, how could you not be when the sun is shining?
Yeah, it is beautiful in some parts of Cork and then other parts are covered with cloud. But I think it's supposed any place that has cloud should hopefully see some sunshine this afternoon anyhow. But
Please God.
Yeah, hopefully we need that vitamin D.
Yeah.
Big time, that's what we do. And speaking of vitamins, let's get straight into questions. A lot of them in, Anneliese. And the first one here, this is from a listener who has a very nasty cough. Now, they've had a course of amoxicillin, but it hasn't shifted the cough. So they've been advised to start another course of this. They're still coughing, and when they cough, they're coughing up very nasty phlegm, and then they can hear wheezing when they breathe, and it takes a while with the coughing to get the phlegm up, and they can never seem to clear it. So then it's back to the same thing the following day. Now they're getting exhausted from the coughing. Is there any cough bottle that you would recommend? This person is on meds for blood pressure and aspirin, and they've tried turmeric, and indeed they've tried honey, but none of that did work.
Okay. So there's two things I would definitely recommend. The first one is the Dr. Delish Clare Mucotone. It's exactly what you need to help get that mucus out of your chest and to start drying up that mucus. And it also has herbs in there that boost the immune system's ability to get on top of the virus. You see, amoxicillin is an antibiotic, so it's only going to work if you've got a chest infection. It's actually not going to do anything to get rid of the cough virus. So you need to support your own immune system to do that. So the Dr. Clare Mucotone tastes pretty revolting, but we sell buckets of it every year, and the feedback is always really, really good. And then in terms of a cough bottle, the Comvita Manuka Elixir is the one that I recommend for that. And actually in that is something called carrageen, which lots of people may be familiar with as an old cure for chesty coughs. So carrageen is brilliant to break up mucus and get it out. So you can actually buy the carrageen and you can cook it up yourself, and you can throw in a bit of turmeric and honey or whatever you want, lemon juice to make it taste a bit better. Or the Comvita Manuka Elixir has carrageen in there as well, and that helps get rid of the phlegm. So I would combine the two of those, and bear in mind that this is a very nasty cough and people are finding it very hard to shift it. So don't be surprised if you don't start noticing a benefit for a couple of days. And then really you might need to kind of give yourself 2 weeks to fully feel that you've recovered from it. So be patient.
Okay, best of luck with that. And Anneliese, is it safe to take lion's mane with statin and blood pressure meds? And will it exacerbate an existing migraine? Any advice for that listener?
It's absolutely fine to take it with the statin and with BP blood pressure meds. Lion's mane is actually getting very popular now, but it's a medicinal, what they call a medicinal mushrooms, and these have been used in Chinese medicine for over 2,000 years. So there is a lot of evidence and safety behind and the safety of their use, especially if you're getting the full body mushroom. It's just like eating mushrooms. Now, sometimes people do get triggered by certain foods for migraines, so it's possible that maybe mushrooms might be a trigger for migraines. Maybe it's contributing. It's very unlikely. Generally the triggers tend to be stress, tension, caffeine. Chocolate is a big trigger. Cheese is a big trigger because they have certain proteins in there. So it may not be anything related whatsoever. So what I'd suggest is stop taking it for a few days. If the migraines clear up, start taking it again. And if the migraines come back, then you have a definite link.
And Anya wants to know, is warm lemon juice first thing in the morning, is that good to lower cholesterol?
No, it's going to have no benefit really on cholesterol. Now, I suppose there's a roundabout way, John Paul, if I think about it, in the way the body works. So lemon juice would be a bitter, and that would stimulate the gallbladder and the liver to produce bile. And cholesterol is gotten rid out of the body via bile through the gallbladder. So it possibly could help in that way, but it would be very minor. So it wouldn't help if your cholesterol was very high. What you really need to look at are two different things. One is what they call plant sterols. So these are sterile molecules that they get from plants that mimic cholesterol. So it kind of fools your body into thinking that you've enough cholesterol and the liver stops making it. So they can decrease your cholesterol by about 17%, and you can buy those in health shops. You can get them in the Benecols and things like that. They have them in there. That's what their thing is for lowering cholesterol. But you can take a higher dose if you take a capsule. Zerocol is an Irish-made brand, and it's very good. The second thing for lowering cholesterol is something called red rice yeast. actually, I think probably this is originally where they discovered the chemical that helps to, the liver, to prevent the liver from making cholesterol. So it's a natural source. It does exactly the same thing as the drug, so you do need to make sure your liver enzymes are checked with your blood tests every year. But it's very successful, and from my experience, a lot of people don't get the same side effects that they get from the statin. So they would be more reliable sources.
Okay, best of luck with that, Anya. And Margaret on email in touch with us. And this is because she's going to Spain, I think it's tomorrow. And she has super sensitive skin. She wants to know, what can you recommend, Anneliese, for protection from mosquito bites? Her holiday last year was ruined because of these bites. So any supplement, creams, oils, whatever works best for her. Any sun creams with protection even included in them from these bites. Okay, what can we offer advice-wise to Margaret?
Yeah. So for a lot of people, you have to start at probably 10 days to 2 weeks beforehand. People find that taking a B vitamin and also garlic capsules can help, because the mosquitoes don't like the smell that comes through the skin. But that doesn't work for everyone, and it's too late now for this lady. So what you're going to have to depend on is creams. Now, there's natural ones and there's ones with chemicals in there. The most effective ones, honestly, are the ones with DEET in there. But DEET is highly toxic. Now, if you're using it for a week, it's not the end of the world. But if you've got eczema or psoriasis or anything like that, it definitely wouldn't be advisable to use DEET because it is so toxic. But it does work for that reason. What I normally recommend is an insect repellent that we have here called Incognito, and it comes as a cream, it comes as a spray, as a roll-on, and I think that works really, really well. Mosquitoes tend to bite more at night rather than the day. So the other thing really, John Paul, as well, is just to cover up and not have your skin exposed, and spray this insect, the natural one, the Incognito. Spray it on your clothes, all over your hair as well, and cover up, and that's really the best advice.
Okay, Margaret, hopefully that works out for you there and have a nice holiday in Spain. And a listener here who wants advice, Anneliese, they're going through the menopause at the moment, but they feel like they're getting depressed day by day. Is there anything that you can recommend to boost their mood without feeling depressed every day, is what this person is saying?
Yeah, it's amazing. And, thank God, John Paul, that we're starting to talk about menopause. And hopefully we'll start seeing a lot more research on the power of estrogen as a hormone, because we're seeing more young women now go into medical research, so hopefully they'll start looking at it. But I don't think we have any understanding of how beneficial estrogen is. Like, there's lots of things that happen when it starts dropping during menopause. Mood is one of them. Sleep is affected. Tendinitis is another reason. You'd never think it was linked with your tendons, but it appears to be. Anxiety is a big one. Sleeplessness, hot flushes, brain fog. All of these are very typical of dropping estrogen. So a couple of things that would help specifically with mood and that we've seen work well here. There's probably a couple of ways I'd go about it. And the first one is I actually would take a plant-based hormone if you're not already on HRT. Or maybe consider taking HRT, because that can work wonders as well for the mood. But there are plant-based versions of HRT available, so you might like to try those. Then in terms of boosting the mood, there's 3 things that could work very well. The first is vitamin B6, and you want to take at least 25 to 50 milligrams of that per day. The other thing is saffron, which is wonderful and has performed in some trials equally as well as antidepressants in terms of lifting mood. And you'll buy that in capsule form in health shops. In actual fact, we have one here that comes together with the B6 and with a bit of magnesium, and we get amazing feedback on it. And then the last thing I would recommend is lion's mane, which we spoke about earlier. And this is great for anybody who's experiencing low mood, anxiety, brain fog. And there's a great Irish young woman who's a pharmacist who's released a range of vitamins, Fab U. And she does one specifically targeted at menopause, which is mainly made up of lion's mane. So she's obviously done her research there as well. So I'd actually try all of them together to try and give yourself a boost. And see how you get on, and then consider possibly going on HRT.
Okay, hopefully that works out there for that listener. And very finally, this is from a person who, for the last 4 weeks, they have felt their balance has been off. They got results of their blood tests and their vitamin D is low. So could that be the cause of the problem? And if it is, can Anneliese recommend something?
So, well, it could be, John Paul. I wouldn't think it would be a very common reason, but I'm always surprised by, the side effects of low vitamin D. So the only thing for that is to kind of make sure that you're taking a good dose of vitamin D to bring your vitamin D levels up. But I think more common sensibly, what I think it could be is it's very possible that you've had some sort of viral infection of the inner ear. It's called vertigo. It's a cousin of the flu virus. A lot of people don't actually get any flu-like symptoms, but they get the dizziness and nausea as if they were seasick on a boat all the time. And for some people, it can be really bad. But it does affect your balance. So that is possibly what it is. And unfortunately, there's not a whole pile available for that. I think to support your immune system and maybe take something that would, like some natural antiviral, that would help. NutriAdvance do one called Virease. One Nutrition have a very good one called P4 Immune. Something like that would kind of help your immune system get rid of that virus, because it affects the inner ear that's responsible for our balance. And it sounds to me it's more likely to be that.
Okay, well, best of luck. And Anneliese, thank you for that. And we'll chat to you again next week on the show.
Thanks, John Paul.
Take care. That's Anneliese Giselle there of the Health Hub in Ballincollig. Everything she mentioned you'll find on the healthhubstore.com, and you can listen back to what you recommended later this afternoon on c103.ie or indeed on the C103 app.